So good morning, everyone. My name is Damon Haycock. I'm the Finance and Research Officer here at the Silver State Health Insurance Exchange, as well as Nevada Health Link, our consumer forward-facing name. For those that have heard my spiel before, please bear with me. I'm going to go over it again for those new participants to today's session. Here in the room with me is Stephen Taylor. He is part of the Xerox team. The Xerox is the contractor that has been awarded the contract to develop our web portal. And so we together are the dynamic duo for the broker and agent onboarding. Today we're going to go over broker and agent onboarding session 2. Hopefully you've seen the presentation. We are recording this. It will be on YouTube either later today or tomorrow. For those that, if you want to pass it on, for those that couldn't attend either in person or on the phone. After the last broker onboarding session, we realized that there was a significant amount of people that had questions that did not have time to answer them. And so in an effort to work hand in hand with this community, we have extended these meetings from 12 o'clock to 12:30. And so hopefully there will be additional time at the end for folks to answer questions. We'll follow the same process we did last time, where we'll ask a question from those that actually attend here in the room and then those on the phone, and we'll bounce back and forth, and hopefully we'll be able to answer most, if not all of them. There are still some processes that we are trying to work out internally here at the exchange, and so if we give you an answer that isn't 100% to your liking, please recognize we're trying to work through this process as well. So I'm going to go over this presentation, and then at the end we will ask for questions. We want to make sure we can get through it all for those that are going to watch it on a recording later. And so please save your questions until the end, and then we will open up the line for questions as well. So without further adu, today we're going to be discussing the enrollment and payments for the Individual and Small Business Health Options Program, SHOP. So we're going to move on to the very second page, our agenda today. We're going to be going over the broker portal briefly, the individual open enrollment periods, the individual special enrollment periods, SHOP employer enrollment and employee open enrollment, SHOP employer and employee choice models, SHOP minimum contribution and participation rates, the special enrollments for SHOP, and then SHOP renewals. So on the third page of the presentation, we're going to quickly go over the broker portal. So here at the exchange, we have developed a different portal for those that are signing up individually, with or without assistance, and then for the brokers and agents. They will be able to manage the clients on the exchange website with their own special, unique portal. On that portal, the brokers and agents will be able to run proposals, perform sales, look at their enrollments of all of their enrollees, do premium payment tracking so they can see who's current, who's not, if they want to manage that part of their process, and then deal with service issues. So on the third page, we have we start off with a screenshot so you can get an idea as to what it's going to look like. Brokers and agents will be able to go forth and check out clients that's circled there in that magenta circle. So you'll see they'll be able to look up by clients. And then on the next page, broker login and license validation, that's where you'll enter in that valid license number to continue to your account. So we, of course, will make sure that we identity proof those brokers and agents to move forward so no one gets into your system and goes in an area where they shouldn't be. Then we're going to talk about individual open enrollment periods. So through the Affordable Care Act, open enrollment begins October 1st, 2013 and goes through March 31st, 2014. So in October, brokers and agents will be able to enroll individual clients in a health insurance plan using the broker and agent portal. And I should clarify, not only individual clients, but employers as well. On December 15th, those clients that are signed up for insurance and have made those payments by that December 15th date will have coverage on January 1st of 2014. Then March 31st, open enrollment closes for those individuals until it reopens in the next open enrollment season. So next year, 2014, open enrollment is October 15th through December 7th, and will remain that way each year until the feds change it. So for individual open enrollment eligibility, there are only 3 things that an individual has to accomplish or attest to be allowed to enroll in health insurance in Nevada Health Link. And these are the same 3 that exist nationwide for all exchanges. So to be eligible for a qualified health plan, that person needs to be a United States citizen, a national, or be lawfully present. Second, that person cannot be incarcerated unless awaiting disposition of charges. And third, they must be a resident or intend to reside in the service area, which for our state, of course, is Nevada. On the next slide, individual special enrollment periods. So if an individual fails to enroll in the initial enrollment period, or an individual experiences a life event, one of these triggering events, this will allow that individual to come back into the web portal and enroll through a special enrollment period. So we've listed, I think, all of the triggers. They should be all of them. If not, they're very close to birth, adoption, or placement for adoption, marriage or domestic partnership, loss of minimum essential coverage, if they gain citizenship, national, or lawful presence where they previously did not have that, if there is an unintentional, inadvertent, or erroneous enrollment, non-enrollment as a result of our web portal or the feds. So if we made a mistake, we allow everyone to come in and have a special enrollment period. If the qualified health plan substantially violates the material provision of the contract, if they say you have access to a certain benefit and that individual no longer has access to those benefits, then that individual can come in and pick a new plan because they've materially, substantially violated a material provision. If there is a change in eligibility for APTC or CSR, advanced premium tax credits, or cost sharing reductions. We're going to focus on those two subsidies on our next session next week, so I won't go into a lot of detail with them today. However, there are many factors that can influence the subsidies that the web portal will determine one person eligible for. Of course, it is the modified adjusted gross income of the household, the household size, which then, of course, determines their federal poverty level, which will determine their percent of income that they are supposed to pay for medical insurance, and then the difference between what they're supposed to pay and the second lowest silver plan. Again, I will go into detail with this all next week, so if you're trying to rapidly take notes, don't. We'll go over it in further detail. But basically, if an individual's household size changes throughout the year, if they have a new dependent, a baby, or maybe there's a split in the family, or somebody passes away, heaven forbid, or there is a significant increase or decrease in that individual's income or household income, that will affect their subsidy. And whether they know it or not, they may need to come in, contact the exchange. Hopefully, as brokers and agents, you will work with those folks and tell them that we need to see if you're eligible now for additional subsidies, or maybe you're receiving too much. Because at the end of the year, if you receive too much subsidies, that individual will settle up with the IRS and may have to pay back some of those subsidies. So to take care of your clients, you're going to want to ensure that you manage this process very, very critically. Also, another trigger is the employer plan is now become unaffordable. The employer plan has to be meet minimum value and be affordable, and there's an affordability clause that we'll talk about a little later. But if they cut the pay of this individual, this employee, to the point where the health insurance is now unaffordable, that allows that person then a special enrollment period to come into the exchange and select an individual health plan. Permanent change in residence to a new service area, that's pretty self-explanatory. If you have a plan that services Las Vegas and you move to Reno, you should be allowed to not pay out of network costs and be allowed to pick another plan that services the area that you currently reside in. And so when people do move from one service area to another, that is a special enrollment period trigger. Then, of course, the American Indian Alaskan Natives, that group of folks is authorized to change qualified health plans once a month. And that is per federal rule regulation. It's written directly in the Affordable Care Act. And so they have the opportunity to basically exist in a special enrollment period every month. And then other exceptional circumstances which are to be determined. There are issues where people will hop on and off exemptions. There's a lot of other issues that we're still ironing out for our business rules. But those are the special enrollment triggers. Then continued on to the next slide. The length of period of a special enrollment period, they are provided 60 calendar days after the date of one of these qualifying events to complete a plan selection. So let's talk about effective dates of coverage because there's some differences here. For birth, adoption, placement for adoption, it is the day of the event. That is Nevada state law. So if you have a baby today and you spend 60 days trying to pick a plan for your family and your baby, that plan for that baby, that effective date of coverage is the day it was born. Same thing with adoption and placement for adoption. As far as marriage, domestic partnership, or loss of minimum essential coverage, it is the first day of the month following the qualifying event date. So if you get married on the 18th, the effective date of coverage is the first day of that next month. For all the others, we have a very standard rule. It is outlined in a code through the Affordable Care Act. If the date that the plan was selected was completed between the 1st and the 15th of the month, then the date of coverage is the first day of the following month. So if December 1st through December 15th, they pick a plan and pay for it, their effective date of coverage is January 1. If they decide to wait until the 16th or 17th, all up to the 31st, then their effective date is February 1. So the effective dates are always 15 to 45 days out. On the next slide, shop employer enrollment and employee open enrollment. So the initial open enrollment, of course, as we mentioned, is October 1st, 2013, and the first effective date of coverage can be available is January 1st. Now, a qualified employer may purchase coverage for its small group at any point during the year. The individual market works on a calendar year basis from January 1 through December 31st. For small businesses on the shop exchange, their plan year is when they enter into our marketplace, and it goes for a rolling 12-month period. A qualified employer may purchase coverage at any point, as I mentioned, and it's that 12-month rolling period. I should actually read my slide before I continue. So, on the next slide, to continue with shop employer enrollment and in the employee open enrollment. So employers must select that purchasing model to offer to their employees at least 60 days prior to the requested effective date of coverage. Once that purchasing model is decided, the employees then will have 30 days to select a qualified health plan. And these are those qualified employees, those full-time employees that are submitted on a roster from the employer to the exchange. We are not allowing part-time employees to participate and purchase qualified health plans on the exchange, only full-time employees. So they will be, the full-time employees, the qualified employees will be provided 30 days to select a qualified health plan based on the purchasing model selected by the employer and to complete that application process. The employer's enrollment and initial payment to the exchange must occur at least 15 days prior to the effective date of coverage. So if you want to have an effective date of coverage of January 1, they need to select a purchasing model 60 days prior, and then they'll have 30 days before the effective date of coverage for that month of December for employees to go in and pick their plan. And then by December 15th, we will need to have that initial payment from that employer that aggregates all of their employees' choices to include the contribution level from the employer, and it needs to come over to the exchange so they can have the effective date of January 1. So let's talk a little bit about employer-employee choice models. So different from the federally facilitated marketplace, federally facilitated exchange, we are authorizing and allowing, and we are providing multiple employer choice models. So of course you have the open metal tier. So an employer can say, I am willing to pay my contribution rate to plans that are on the silver level tier or the gold level tier or the platinum level tier. An employer can choose, I am willing to contribute to my employees' purchase of health plans and an open shop. So every plan that exists in the service area that my business is in, that my employees qualify for, whatever exists on the shop exchange, I'm willing to participate and allow them to have that variety. Then there's a one carrier package. Maybe the employer has made a decision to go with one of the carriers that is offering qualified health plans on our shop, and says, I am okay with any of the plans that that carrier is offering, but only that carrier. And then there's a carrier partnership package where multiple carriers will agree to partner up and bundle plans together because of either synergies or networks or whatever situation that they have. And the carrier partnership package can be an option selected by the employer that says, I'm okay with carrier A and carrier B's specific bundled plans in my service area. Premium aggregation is one of the benefits, of course, of the Nevada Health Link of our exchange. We'll be provided starting in 2014 for all the purchasing options. So if an employer has 12 full-time employees and they all pick 12 separate qualified health plans, we're going to send the employer one bill. And the employer's going to pay one bill, and we're going to receive the funding directly, and then we're going to split that funding out and pay each of the carriers independently. So we will handle that administrative process for employers. We're also going to do that for the individual plans. If a family of 4 purchases 4 different qualified health plans, we will send them one bill. They will pay us one check or one transfer or one credit card payment or whatever, and we will then collect that and then split that into the different different payments to different carriers on behalf of them, so they don't get 4 bills having to write 4 checks. So let's look at a little bit better descriptions, a little better visual of those purchasing model options, as you can see on the next slide. So the all carriers, one plan, that open metal tier option, as you see, they've X'd all of those in silver. The employer wants to have all silver plans available. Directly to the right of that, one carrier, one package, that's carrier B, and because that carrier offers a gold and silver plan on the shop exchange, those are the ones that are available for purchase by the employee. At the bottom left, all carriers, all plans, whatever exists in the service area, you get an opportunity as an employee to make that decision. And then the carrier partnership, as you can see, carrier B and carrier C have buddied up together, and these are the plans that they are offering, and they're offering them together, so this is an option that an employer can choose. So on the next slide, we talk about the shop minimum contribution and participation rates. So for the employer, all plans in the shop exchange have a standard minimum contribution rate of 50% of the lowest cost qualified health plan available to the employer's employees. So on that open shop, if they say all of the shop plans that are available in my service area, I want to make available to my employees, they're required to contribute 50% of the lowest cost plan. Same thing if it's on an open metal tier or if it's a carrier plan, whatever the least expensive plan is, the employer is required to pay a minimum of 50%. The employer can pay more, and we're all for that process if that helps them retain their talent, and that's what they want to do to support the health plans of their employees, but we're requiring a minimum of 50%. And the minimum employee participation rate will be 75% of eligible employees, and this gets a little tricky when you talk about eligible employees. So if you have 10 full-time employees, that would say that you need to have 7.5 of them, or you can't have half of a person, so you need 8 of those folks to enroll in a qualified health plan so that employer can maintain eligibility on the shop. However, we reduce that denominator, that 10 available full-time employees, based on specific circumstances that mean that you shouldn't have to purchase a plan. So if they're already receiving minimum essential coverage somewhere else, maybe their spouse is working for another employer, and that employer is offering minimum essential coverage, then they're not required to be part of that participation requirement. Maybe they're not a national or lawfully present or citizen, so that person cannot be eligible for a plan, should not be used against the employer. Maybe this person has filed for an exemption because of unaffordability or religious conscience or any of the other exemptions. So that means that person should be reduced from that census to determine the minimum participation rate. So we do require 75%, but the key word here is eligible, of the eligible employees. On the next slide, we'll talk about, again, continuing with shop eligibility. So now an employee, in order to be eligible to participate as an employee on the shop to purchase a qualified health plan, that employee must receive an offer of coverage from the qualified employer, obviously. They must be an eligible employee as defined by the employer. So the employer, like I said, will submit a roster of their full-time employees. New group, if it's a new group, the person must be hired before the group's effective date of coverage. If it's an existing group, then they must complete the group's waiting period if they're a new hire. And we have elected to allow a 30, 60, and 90-day waiting period up to the employer choice. We're not allowing a 0-day waiting period because we want to ensure that we do not insert a lot of adverse selection immediately into the market where an employer signs up day one and then sends in all the people that need assistance today and then dumps out of the exchange the month later. So we do require an actual waiting period. Again, there's also the special enrollment events, which are very similar to the individual, and I'll go over here shortly. Continuing on to with shop eligibility for a spouse. Spouse has to be legally married to the employee or a domestic partner, and the domestic partnership is at the option of the employer. What the exchange will require if the employer says they will cover domestic partnerships is they need to have a domestic partnership on file with the Secretary of State's office. And so we will allow domestic partners, but it is solely at the discretion of that employer if they want to offer those benefits. Dependents, of course, children born to adopted or legal guardianship ages 0 to 25. And then disabled must be declared disabled by the Social Security Administration prior to enrollment and, of course, submit the proof. So those are the eligibility for spouses and dependents. And we'll talk about special enrollments for SHOP next. There's a table here we've inserted into the next slide. So they're very similar to the special enrollment triggers that are for the individual market with a few differences. Again, a permanent move to a service area, although the time frames are different, so we have 30 days. Birth adoption or placement for adoption, of course, the effective date of coverage is the date of the event, but the time frame, again, is only 30 days. They don't have the full 60. Medical coverage court mandate, domestic partnership or marriage, loss of minimum essential coverage. You've seen all these. The tribal special enrollment, again, a member of an Alaska Native or American Indian federally recognized tribe is authorized to change their qualified health plan every month if they so choose. That doesn't stop if they are on the shop. Continuing on to the next slide, we have more of the table. Active duty military, if you return after your TRICARE ends, so basically you lost that minimum essential coverage you had when that military individual was gone on deployment. This applies very often to National Guardsmen and reservists who get deployed for 6 months at a time or wherever, and they receive their medical coverage from the military. When they come back, then they have a special enrollment period as they get reinserted back into their job, and they can get the qualified health plan selection then. If, of course, loss of Medicaid or other public assistance, again, this is all loss of minimum essential coverage. A return from leave of absence. And, of course, if the qualified health plan in which he or she is enrolled has violated a material provision, just like the other trigger we talked about for the individual side. So continue on to shop renewals. So the exchange will send a renewal information to the employer about 90 days prior to the plan year end. And that employer will then be able to go back into the web portal with or without the assistance of brokers agents, depending on your relationship. And they will have 30 days to submit changes to the purchasing model. So maybe they decided they had open shop and they don't like open shop, they want open metal tier, or they really like this carrier, so they want a one carrier plan or one carrier model. And then, of course, they can make changes to their contributions. So they're going to declare their contributions. We, of course, mandate 50% of the employee, but we don't mandate contributions for the spouse or dependents. And so if they, 1 year, business is doing well, and they want to put 100% to the spouse and dependents and 100% to the employee, and then didn't work out the way they were hoping, and so they want to reduce it, they have that opportunity during that purchasing model choice to make those changes to their contributions. The employee then, again, will have 30 days to submit any renewal changes, much like it exists today. You get your open enrollment packet. Please go in if you want to make any changes, add, drop dependents, change your plans. You can do that very similar to how that works today. And usually open enrollment for employees is 30 days, so we're following suit. If the employee does not submit changes, then the employee's plan will auto-renew. If the plan the employee is enrolled with is no longer available, so if that employer picked a different purchasing model and that employee's qualified health plan is no longer available through that employer, the employee then must make a new plan selection. And so I actually thought that was going to go a lot slower than it did. So we're going to have a significant amount of time for questions. Again, we're going to be going over the tax subsidies and tax penalties at the next session. And the session after that is kind of a catch-all. We go over appeals. We go over, I don't know if you have them up right now, but we go over a plethora of things that we couldn't quite fit into one of these specific sections. One thing that you will see before I open up for questions, just in case anybody is on the line and wants to dump off for something else, the next session's presentation is already up. We posted that at the end of the day yesterday. I'll send it out on the listserv to point everybody to it. I will be updating the schedule because what we want, we've had some requests from others so far about branding and how to go ahead and utilize our logo and to partner up with our exchange when they market for their clients. And so what we're looking at actually doing is we left that open-ended August 21st, outstanding issues. I think what we're going to do is we're going to bring our communications officer, CJ Bowden, in, and he's going to give a presentation on our brand standard guides and marketing and working with the exchange and receiving any of the written materials that you can hand out to potential clients, etc. So I will go ahead and update that schedule in the next couple of days and post it back out on our website. So to bring it full circle, next week is credits, penalties, and taxes, and the week after that, reporting, appeals, and other topics. So we will talk briefly about Medicaid and CHIP and some more tribal client specifics, reconciliation, reporting, the file transfers, how to get any assistance, standalone dental plans, underwriting, and then the appeals process. We may add a few things to that for that August 14th one. So with all of that said, I think at this point, I do want to thank everybody for participating on these. I hope they've been helpful. We have received a lot of questions, and we're trying to answer them as quickly as possible. We did not receive specific questions related to these or this specific session. So normally we would be able to answer those. So if you do have an opportunity to take a look at the next session before you come or listen in or call into this meeting next week, if you have specific questions about the advanced premium tax credit, cost sharing reductions, tax penalties, the small employer tax credit, and the employer responsibility penalty, send it to us. We'll add it to the presentation unofficially, and we'll discuss it at about this time next week. But without further ado, I'm going to turn it over to questions. Athena, if you will please turn on the phone for questions, and then I'll take the first question from the gentleman here in the room.
Thank you, Damian. On the two questions, one is will as far as the participation level on the shop exchange, if someone comes in and proves coverage that they have already received coverage through the exchange on an individual basis, is that a legitimate waiver as far as the participation requirement?
So, and this is a very good question, because I would normally have cautioned that employee not to, because that employer, before they pushed the employer mandate off, the employer would have had to pay a tax penalty on employees, potentially on employees that enroll on the individual exchange. So, and there's requirements for certain size employers to offer those exchange to offer those plans on the shop. But to give you the quick answer, no, they were receiving minimum essential coverage, so therefore they should not be applied to the denominator of the participation rate. And what I will do, though, is I want to circle back to this, if you'll make sure, Steve, I want to double check, because by all definitions and technicalities, that should work. They enrolled on the exchange, and so if you have 12 employees or 10 employees and you need 8 of them to participate, if 4 of them went on and got a subsidy on the individual market through the exchange or off the exchange, they have minimum essential coverage, and those 4 should not be part of the denominator, and now they just need 4 of 6 to sign up, if that makes sense.
It does.
Let's take one.
To place all participants in talk mode, press 1 to begin a question and answer. Your conference is now in question and answer mode. To summon each question, press 1, then 0. You have 0 questions remaining.
Awesome. Let's go with... Oh, I'm sorry. Do we have a question on the phone?
You have 3 questions remaining.
When will the 4-hour in-person seminars be held?
Okay, so very good question. We are finalizing. We have to figure out how many sessions we need to have, and so one of the other things I meant to say at the beginning of this is we're going to be posting a form. Basically, it's an intent to offer or to sell insurance on the exchange. It's not a legal binding contract, but it will help us determine how many folks we need to set up training for and in what locations. And so I'm going to send that out through the listserv, post it on our website today. And if you'll go through it, just ask for some basic demographics. Who are you? What's your national producer number? Where, and of course we're going to list the four carriers that are providing qualified health plans. We don't expect folks to want to sell on the exchange if they don't have an affiliation. However, if you want to have an affiliation or you're in the process of getting that affiliation later, that's no problem. We'll still put you through the 4-hour training. But we need to know how many of these trainings to determine when and where they're going to be. So that's a long, drawn-out answer to the basic time frame is we're going to be doing these in September. We can't see a reason to do them before September, only because we need you to also be able to get your login and learn to navigate the system, and our system has to be in an almost go-live state for you to do that. We're going to take the information that you send in on that basic letter of intent, and we're going to pre-populate the process so you're not sitting there walking through entering in all your demographics into our web portal, so we can speed up that process for you guys. And so that's another reason why we need that information. But we are going to we're going to definitely have those training opportunities throughout Nevada. So it's not like if you're in Las Vegas, you have to fly here, or if you're here, you have to fly to Vegas. We're looking at working with synergies out in Elko for those in the rural. So we're looking at trying to pick up everybody. But the short answer is in September, it will be determined, hopefully from the response I get from the letters of intent, I'll be able to come up with a schedule or potential schedule so everyone can start flagging their calendars. Do you have a question here in the room?
My question relates to eligibility. So when you were talking existing groups and what their eligibility period could be, you mentioned that the exchange will offer 30, 60, and 90 days.
That's a waiting period.
Right. And my understanding through ACA would be that my employees need to be covered within 90 days. So if you offer a 90-day waiting period, I first of all want to clarify, would everybody be effective the first of the month following that waiting period? And second of all, what of those groups that want to have people effective immediately or maybe within the first month?
So let me see if I answer, because there's kind of three parts to that. The easy one is we do things on the first of the month. The only thing we don't do on the first of the month is birth, adoption, or placement for adoption. Everything else is first of the month. It's a lot simpler, and that's the business process here for the exchange. And so if they're required to have it on the 90th day, and the employer has required a 90-day waiting period, but that 90-day takes them into the 17th of the month, then it will have to be the first of the month prior to the 90th day. And so we're going to have to make those adjustments to make sure that we're in line with the Affordable Care Act and that we meet our business processes. We can't make them wait 103 days because they're 90 days.
Your longest period would be a 60-day wait.
I think you might be able to, depending on how you do it, you might be able to actually work it to a 90 days. It depends if February is involved. There's those shorter months. So I know that the current business rule is 30, 60, 90, but we'll double check and I'll give you I will readdress this next session.
I have two other questions if I could get those in.
Okay, fire.
So the first one has to deal with dependents. So the children are born to, adopted, or legal guardianship. Are there no stepchildren allowed?
The stepchildren are allowed. That was a mistake on my part for putting that in there. My apologies. Stepchildren they're part of dependents. So.
Okay, and then my third question is actually a larger question. What about groups that have COBRA participants? Are they to be included in that number?
So, if you were on COBRA, my understanding is that through federal COBRA law, those individuals have to be provided the same opportunity for the same plans that are available to everybody that is offered those plans by the employer. So if they initially come onto the exchange and they have people enrolled in COBRA, those people are already receiving minimum essential coverage, and so those folks then do not account for that denominator because they're already receiving coverage. Now, once they're on the exchange, and if they end up losing their job and then they want to get on COBRA, again, they've lost their job, they're off the roster, they're not part of that denominator for that part of the discussion. However, COBRA is a employer responsibility through the federal law.
Right.
And so we're trying to figure out how to administer COBRA. Right now, it's supposed to be administered by the employer. Today, the carriers often will do it for the employer because they have a one carrier situation. We don't see that working because if you have an open shop model and you have all 4 carriers, who gets to manage that person's plan if when it's time for them to get on COBRA, they actually are allowed to choose any of the plans that are available, not the one that they're necessarily on. So they can go to another carrier's plan. And so if they were on one carrier A's plan, and they choose carrier B's plan, then should carrier A be paying carrier B, and should they be collecting funds? And so right now we're trying to figure out if we can look at a third-party potential situation where we can recommend to an employer, your employee has lost coverage, or you have just terminated your employee's coverage. Recognize that your employee is authorized to be on COBRA, and because of those issues, you will have to manage that process. However, we know of X, Y, and Z companies that may be able to assist you for that 2% admin fee.
And so I'm not sure if I understood the answer. If I'm bringing on a shop employer group that has 15 employees, at the time these people were eligible for COBRA, that we had over 20 in this group, so they're eligible for COBRA. Do I count them because they're currently on COBRA? Do I count them in my numbers, or
No.
what I call a census, to come on to the exchange?
No. So what you would do is you would submit your census of all full-time employees, and then on the side of that census it would say, decline coverage for, spouse. I have coverage for my spouse. I have COBRA. I have X. I have Y. I have Z. I have an exemption, whatever, and so that would reduce the amount for the participation level.
Okay. So I do not enroll my COBRA participants when I enroll under SHOP.
No, because your COBRA participants are authorized COBRA at the time in which they're authorized COBRA, and so they have to be provided all the plans that are available at that time. So if they're already on a plan, they're already participating in COBRA, they're already going through that process.
But that plan ends.
If that plan ends, then
Because I'm bringing my group onto the exchange.
yeah,
So there is no COBRA opportunity for those people. They're left out to go on their own.
write that down. I gotta find out. Let me find out, and then I'll send. And then we'll update our Q&A.
Okay.
Let's take one on the phone, please.
You have 2 questions remaining.
Hi, my name is Michelle. I have 2 questions for you.
Okay.
The first question is regarding the individual open enrollment period. It appears that the effective date will always be the first of the month. So for the initial open enrollment period, if someone enrolls, say, after December 15th, they enroll the 16th or by the 31st of December, is their coverage then effective February 1st and it would follow suit from there?
That is correct.
Okay. And then my last question for you is, you were going over the SHOP eligibility with regard to spouse and dependents. Dependents at age 26 and not 25?
It's up to the 26th birthday. You're allowed to remain on your your parents' plan, unless you have there's a couple disclaimers. If you're physically or mentally disabled, where you need to still receive assistance from your parents, you can bypass that 26th birthday. So I really put 26th birthday, so please forgive me.
Okay, that's all I had. Thank you very much.
Okay. In the room, I'll get you next.
Damien, yes, you mentioned 4 carriers in the SHOP exchange. Have those carriers been determined?
So we announced the carriers that will be participating on the exchange. We announced it Friday.
Yeah.
If you want, I can just go ahead and fire off from that announcement.
Are those the same as in the individual market?
Let's see. I know for a fact that we will have SHOP coverage throughout the state. So there will be no service area that has no qualified health plans available. We still haven't received the plans from the Division of Insurance, so we haven't been able to kind of dig into them and see all the different parts of them as of right now. I don't know if all 4 are going to be offering SHOP. but I will find out and we'll update our Q&A.
So this was down to Health Plan of Nevada, to St. Mary's,
Right.
to our exchange, our co-op, and all
And
four, and Anthem.
Right.
So those four are the possible players for SHOP.
Correct. And then there may also be a multi-state plan where we're dealing with OPM at the federal level, and then that multi-state plan will be inserted into all the exchanges.
Okay.
And so
federal plan?
that's it'll be one of it won't be like a federally, it won't be a federal carrier, it'll be a commercial carrier, but it is a process that the feds are managing and will be inputting into the exchanges.
So is there a possibility of a fifth player coming in as far as,
No.
have we gone past that point?
We have gone past. So the four carriers that are available on the exchange, the four carriers that have submitted plans that are almost through plan certification right now are Health Plan of Nevada, Anthem, Co-op, and St. Mary's.
Okay. Both in the individual and group.
I know for a fact they're all in individual.
Okay.
I don't think all four of them are in group,
All right.
but I will double check, and then we will update our Q&A by the end of this week, early part of next week, and then I'll send out something on the listserv saying go take a look. We've updated your questions and answers.
Thank you.
Let's take one on the phone, please.
You have 3 questions remaining.
Go ahead.
On our groups that we have, existing groups that maybe they renew 12/1 of this year, 12/1/2013. So they'll be able to stay on their plans all the way through 12/1 of 14. And my question is, since those plans are not going to actually be like the tier level, they're going to be the existing plans that are in the marketplace now. They're not going to be bronze, silver, etc. How is an employee going to know if this meets the minimum, if their current plan meets the minimum essential benefits or not?
So minimum essential coverage is defined in a U.S. code. I think I don't know if it's 36B or if it's 5000A, but it defines it as an employer-based plan. And so obviously, I should say obviously, is my interpretation that they try to keep it simple because they knew that all plans in 2014, that began in 2014, have to meet minimum essential coverage, and so they made it kind of a circular reference. However, there are plans that can be grandfathered, and there's a whole bunch of different situations around those grandfathered plans. And to be honest with you, I'm not well versed with what is going to be grandfathered and what is not going to be grandfathered. I would direct that question to the Nevada Division of Insurance, only because we will not be dealing with grandfathered plans on the exchange. All of the plans on the exchange are brand new, so we've had to focus the bulk of our attention to those specific plans. I hope that doesn't sound like a cop-out. However, if one of the requirements for the participation rate is that all full-time employees in the service area, that we require 75% of them unless they have coverage, minimum essential coverage elsewhere. I don't have the right answer for you right now, but I'll add that to my list of questions to answer for next time. If a grandfather plan that does not meet the current Affordable Care Act requirements count as minimum essential coverage. Is that correct?
Yeah, I guess I'm just trying to figure out, because you're saying that qualified changes or people qualify if their plan doesn't meet the minimum essential benefits. So if you have a client right now that has an HSA with a $3,000 benefit, are their employees eligible for deductible? Are they eligible for the exchange because it doesn't meet the minimum essential benefit? So
it's not. First, you got to look at, are we talking shop exchange or individual exchange? On the shop, for either. So on the shop exchange, that employer will go on and that employer will select a new plan or new series of plans, and then those employees will be authorized to, those qualified employees will be able to, through their open enrollment, pick that plan. So the question is when that plan expires. I think and I have to double check, but I think that, you know, there's specific notices that have to go out. And we put that on our website for employers, that they have to notify all of their employees of the existence of the exchange. And there's a whole slew of the requirements as well as templates that are out there on our website. However, we need to look at, let me find out, is the best answer I can give you. And I apologize for not having all the answers today.
Okay, can I ask one more question too?
Of course.
If we have small groups that are existing clients, and let's say that they want to stay with their plan until the renewal date. Like, let's say that the renewal date is 6/1 of 2014, right?
Right.
Could we shop? I'm understanding that your open enrollment, when they renew 6/1 of 2014, the exchange would not be an option until next open enrollment, or could we sign up a new group in the middle of the year on the exchange?
So you can sign up a group at any time. Anytime on the exchange, you're authorized to sign up a group. There was discussion at the federal level. I think it's in one of the rules, if it's proposed or final. I'm not certain, that they were trying to determine an open enrollment period again next year for SHOP, and that's for people who couldn't meet the minimum participation rate requirements during the first initial open enrollment. But all of the regulations, all of the business rules that we have seen, that a new group can enter into the SHOP at any time as long as they meet the eligibility requirements of our exchange. So if you have a plan that goes away in June of next year for one of your employers, then you can come to the exchange and go through the process of enrolling that employer on the exchange and having them pick their model, and then opening up open enrollment for their employees. Just make sure that you tie your timing down right, so that way they don't have a lapse in coverage.
Okay, thank you.
You're welcome. Let's, gentleman here.
You said that for domestic partners, it was discretion of the employer. Will they be allowed to say whether they allow same-sex partners, or it's like if you do domestic partners, it's anyone who's domestic partner? So
it's my understanding that, and as it was written here, the employer gets to decide if they're going to cover domestic partners or not. The Nevada Constitution defines what marriage is, not the exchange.
Okay.
I know that there are some potential pitfalls with the rules that have come out on how we're going to cover and the discriminatory potential issues if someone receives coverage in one state that does authorize same-sex marriages, and they come over to our state, and because ours is strictly domestic partnerships, there may be some issues with that. But the short answer is domestic partnerships are approved at the employer level, and those domestic partnerships must be certified to this Secretary of State's office. And then we will be able to utilize that as an option for those employees.
So it'll be following just the state definition. It won't be an employer who goes, no, I don't think that two people of the same sex should be a domestic partner. I'm not allowing that.
Domestic partnership, the definition of domestic partnership is not up to the discretion of the employer or the discretion of the state. Let's take one on the phone.
You have 2 questions remaining.
Go ahead. Anyone on the phone? So I'm gonna, before you can go ahead and move to the next one, but don't put them on yet. So there's a couple of people that have been calling into our standard line, and not this line. Maybe they couldn't get on because the line was full. So I want to try to address some of those real quick. So there's a question about employee or employer notification letters and how to fill them out. If it's the notification letter that I was referring to, that employers have to notify all employees of the existence of exchanges, that form is located on our website under our employers section of our resources. So exchange.nv.gov, go to the resources tab. On the left is a menu of different pages. One, of course, is our broker and onboarding page, but there's also one for employers. And right there near the top, after the sign up to the listserv standard language, there is the employee notification letters and a couple of templates. So that's where that is there. And if you need assistance filling those out, you can contact us, and we'll see what we can do to help you. Is there going to be an online certification? As this time, there is not. I'll go over the certification again because it seems to be a huge hot topic here. And as of this exact moment, in order to be, and it's not called certification, I want to use the term appointment because they mean two different things. To become appointed with the exchange to offer or to sell insurance on the new exchange marketplace, every unique broker, agent, producer that wants to participate will have to show up in person to a 4-hour training session where we will not only train them on the use of the web portal, navigating through that web portal and establishing their broker/agent web portal account through their unique login and password, but we will also do identity proofing. We will also bounce your information off of CERCON, the Nevada Division of Insurance's database of producers, to ensure that you are still licensed and in good standing. And then we will snap a photo of you, so dress up nice and smile, because we will give you an ID card that you can present to any of your clients or potential clients that say you are appointed with the exchange. We can't do that if it's an online certification process. Now, we recognize today that there is a multitude of sales for insurance and a multitude of lines that are done online. And so we are going to explore that possibility for web-based brokers and for any type of web-based certifications or recertifications or appointments. But we have a very limited amount of time right now to get done everything we need to get done to open up this exchange October 1. And so right now, per our lovely ticker at the bottom of most of our pages, I show we have 61 days left. And so in 61 days, the bulk of our emphasis right now is flipping the switch and allowing people to enroll in insurance. It's not that we don't value the opportunities or the current business practices of brokers and agents. We want to work with you guys. We recognize that you are critical to our success. But systematically, we only have so many hours left between now and go live. Now, are we going to be able to look into a future date and provide this opportunity? That is something that is on the discussion block right now. And then finally, for the last question, Nevada, they have Nevada companies with employees that live in Arizona and Utah, but they work in Nevada. What exchange is she supposed to sign them up with? Okay, so let's look at it two different ways. An employer that exists in Nevada but has employees that are working out of state, the federal regulations say that we have to allow that employer to enroll all eligible employees, all full-time employees, in our Nevada exchange. So we can, if the employees work in Sacramento but the home office is in Vegas, they have to be provided the opportunity to enroll their employees in the Nevada exchange using the Vegas service area. We would hope, and we are encouraging employers, we hope you would encourage employers, that it's not necessarily in that client's best interest, that employee's best interest, to enroll in a plan in Vegas and pay out-of-network costs for their services that they want to participate in Sacramento. And so what we would do we can't do it by regulation, but we can hopefully recommend to those employers that they should probably look to enroll in, we'll say, California's exchange for their California-based employees, so that they can receive the best variety of plans and network services for their employees. So take that on the inverse. California, or in this case, I believe it's in Arizona and Utah, the company, they have employees that work in Las Vegas or Reno or Elko. If those employees also live in Las Vegas, Reno, and Elko, those employees may want to utilize the services in those service areas. So when that occurs, the exchange will allow those out-of-state employers to enroll their in-state employees into the shop exchange. And their participation requirements are only, again, those in the service area. So if they have 20 full-time employees, but only 4 of them are, 4 is probably a bad number because you'll see real quick, but 4 of them are in, no, 4 is good, 4 of them are in Vegas. 3 of those 4 have to enroll for participation, not all 4 to make up the 7 total of this, or 8 total of the 75%. So 75% of the people that are in Nevada, the full-time people who qualify, again, reduce the denominator by those that are receiving coverage elsewhere, by those that are not required to purchase coverage, by those that have an exemption. So all those things still apply. But what should this client do? This client should potentially enroll in all 3 state exchanges to provide that coverage for their employees. They don't have to. If they are, again, an Arizona-based company, they can put all their employees in their Arizona-based exchange, and they can move forward and deal with that process. They'll enroll in a multi-state plan. So therefore, that network size grows larger. And again, we haven't seen that multi-state plan, so I can't speak too much to it. But there's another option as well. So there is no what should they do, it's just what can they do. Let's take, I think the last one was on the phone. Let's take one here.
Yeah, I have a few. So for a person who's a licensed health insurance agent and receives a job offer to be a navigator, what kind of certificate do they still need to go through the 20-hour certification process?
And so let me back that up a little bit, because this is a great opportunity to share a little bit more information about this process. But the short answer is yes, they have to go through the process. They have to go through it because there are specific differences between being an exchange enrollment facilitator and being a licensed agent and producer. You have to go through that training because there's certain things now you can't do that you could do as a broker or an agent. So as a broker and agent, you can say, based on your information you've given me, client, I think this is the best plan for you. This plan right here is the best plan because it costs you this, and this is going to help you and your family receive the coverage you need. An exchange enrollment facilitator, which is the umbrella for navigators, enrollment, exchange enrollment, or enrollment assisters, and certified application counselors, that designation, that EEF designation says you cannot recommend a plan. You cannot recommend a carrier. I think you should go with carrier A because they do X. You can't do that. And so no licensed producer that hasn't attended today or has read about our Navigator program will know that. And so we need to make sure that there's that delineation, that line in the sand. However, if a broker or agent, a currently Nevada licensed on any line, any insurance line, the passing of AB 425, the Division of Insurance's bill, this section, specifically states, and I think it's section 9, but don't quote me, that an exchange enrollment facilitator cannot also maintain a license to sell insurance in any line in Nevada. So if you want to be a navigator, it appears by this law, you have to sacrifice your license to do so. Does that answer your question?
Yes.
Let me get one on the phone and then I'll bounce around again.
One question remaining.
Are you taking any questions regarding carriers?
I can. What's your question?
My question is, on your website, you're showing 4 carriers currently that have give potential prices. On the Nevada Division of Insurance website, they currently have 12 carriers that are showing prices. Will you be updating the site as carriers come on board?
And so the reason why there's a difference between both of those lists is we are only specifically showing those carriers that are offering products on the exchange. The Division of Insurance is showing the carriers that are offering products on the exchange and off the exchange. The only additional carriers that we will be announcing is those that make it through plan certification for standalone dental products. There's additional carriers that will be offering the standalone dental plans to meet the pediatric dental essential health benefit requirement of the Affordable Care Act. Those will be announced through the Division of Insurance again, and we'll be posting it on our website when those carriers are brought on board. But we wanted to get out the initial qualified health plan carriers that will be participating specifically on the exchange.
Okay, thank you.
You're welcome. I want to get one from someone who hasn't talked yet. Let's go ahead, sir. Did you have your hand up?
No.
Go ahead.
Oh, yes, you mentioned on the call center, can call center employees recommend a health plan?
Call center employees will be certified as exchange enrollment facilitators, and they will have to adhere to all the specific requirements for conflict of interest.
Okay.
They will be able to answer general questions and discuss what are the payments and what are the costs, but they cannot pick one plan over another on the shopping compare screen.
Thank you.
Let's try one on the phone again.
You have 0 questions remaining.
Is anyone on the phone? When that happens, does that mean that there isn't one or that there's one left?
There's
None. Perfect. Go ahead.
Okay. So currently, when we enroll a group, we have to have a quarterly wage statement that we submit to the carriers. Now, you said the exchange is only asking for a census. How are you going to be able to tell if somebody is part-time or full-time when you just receive a census?
So, one of the specific parts of the Affordable Care Act is that the Affordable Care Act is allowing for a lot of attestation. I attest that I am making X amount of dollars a month. I attest that I am a Nevada resident. I attest that I have this situation in my household. And then if we determine through reconciliation that there's a significant difference, then we have to go back and request additional information. But traditionally today, if I'm going to sign up myself, my wife, and my children, I have to submit birth certificates and marriage certificates and all those. The ACA has relaxed a lot of that. So we are taking an employer's self-attested full-time census, which they can update at any time, and should. I'm not saying they will, but they should. Also recognize that the Affordable Care Act allows you to meet the participation requirements on day 1 of your plan. And then on day 2, if you lose an employee, that plan still remains in effect for the full plan year. At the same time, if the small business health on the shop, if you only have 49 full-time employees and you grow to 130 during the year, you're still authorized to remain on the shop until the next open enrollment, where then you have to potentially look for a different type of health insurance portal. Do we have anyone on the phone, Athena?
You have 0 questions remaining.
Go ahead.
I just need to get a definition of the term lawfully present.
So, what I want to do, just so I don't get tripped up, is I want to actually cut and paste it and put it as an answer for you guys, because I've been asked that before. But a lawfully present person, there's a specific definition, and I can't rattle it off the top of my head right now, and I don't want to be wrong and then be quoted later. So let me add that, Steve, will you, to the Q&A, and then we'll make sure that you have it and the source we got it from.
Thank you.
Go ahead.
An employer hires someone that has underage Medicare disability. Will that count for their minimum coverage, or will they have to be counted for the participation? Will that person then be allowed to go in and buy?
So it depends on what that Medicare disability covers. So
it's Medicare.
If it covers all of the basic minimum essential, coverage, then that person will not have to go in and be counted as part of that participation. Again, the point of the participation requirements is that we need participation from all those who are eligible. If you are receiving minimum essential coverage somewhere else, you aren't eligible for coverage on the exchange if you have TRICARE or Medicare, or you're receiving, so if you're like a spouse or depending on someone else's plan, you're receiving that coverage. And so you, I believe from the way that you placed it, no, they wouldn't be counted in as part of that denominator for participation requirements. So Athena, how will we know if we have any more? Do we just have to keep pinging it?
Just keep trying.
Okay.
You have 0 questions remaining.
Any more questions in the room? Please.
This is probably down in the weeds for you, but if I'm an employer and I have employees covered, say a husband and wife, and I'm covering more than the 50%, and they also have a child, and the child is eligible through tribal benefits.
Okay.
And so because of the cost to the family for the dependent coverage for the child, they've put them on Indian Health Services.
Okay.
Am I required to put that child through the exchange on my plan?
No.
Can the child stay on IHS benefits?
Yes.
Okay.
And that goes for both the individual and the shop exchange. Those on IHS remain on IHS, and that doesn't And they won't be, the individual that's on IHS will not be assessed for the individual mandate.
But if I am then on IHS, I have another friend that is on that. I can also go through the exchange if I want to.
We will not stop anybody from purchasing a qualified health plan who is legally present here, who is not incarcerated, and who is intending to or who resides in Nevada. If you want to purchase a qualified health plan, I mean, we would have asked this question before. We have a 66-year-old individual, that's being told they can't purchase a qualified health plan. Sure you can. Are you going to get a subsidy? No. But please come to the exchange. We would love to have you, and we will try to provide you the same great customer service to all of our clients, no matter what their situation is.
Thank you.
Any more on the phone?
You have 0 questions remaining.
Any more in the room? I think we'll just take one more here because we're dwindling down. I think people are hungry. Go ahead.
Okay, so annual open enrollment period for employers through SHOP. Currently, in the group market, the open enrollment period is 30 days prior and 30 days after the effective date.
Okay.
The 30 days after goes back retroactive, of course, to the original effective date. Now you said it was for the SHOP, it's going to be 30 days, and I'm thinking that those are the 30 days prior.
They are. So we don't do retroactive enrollments or retroactive coverage, with the exception of births, adoptions, replacement for adoptions. And so, or those like that have the very first of the month thereafter you get married on the second of the month, and you're supposed to have effective coverage the first of the following month, and you don't tell us for 60 days, and then you come back and tell us your effective date is the first of the month following that life event. So there are a few backwards retroactive enrollments, but no, your employees will need to enroll prior to the end of their prior to the beginning of the next enrollment period. I think with that, unless someone has a burning issue, I'm going to go ahead and end today's session. I want to thank everybody for participating and coming. Hopefully you've learned some information, and I know I didn't have a lot of answers, but I will get those answers to you and make sure they're available to everyone. And it does help if you ask questions ahead of time, so I don't say a bunch of I don't knows. But thank you for participating. The next meeting is next Wednesday. Please fill out your letters of intent if you plan on participating on our exchange, either on the SHOP or on the individual markets, so we know how much training time we need. And keep an eye out for the information being sent out on our listserv. Thank you very much.
There are 54 participants on the call, including you.